Time and time again, Bascom Palmer Eye Institute has transformed the world of ophthalmology through innovation. For more than 50 years, our institute has been committed to preventing blindness and helping people maintain their vision. Join us as we trace the history of this pioneering institute. Learn how our doctors and scientists have impacted eye care around the globe. Our story begins in the 1920s when Dr. Bascom H. Palmer arrives in Miami. As one of the first ophthalmologists to practice in the young city, he dreams of creating a world-class eye center in South Florida. His lofty goal inspires the founders of what would soon become Bascom Palmer Eye Institute. In 1958, the newly established University of Miami School of Medicine recruits Edward Norton from Boston to chair its division of ophthalmology. A year later, Victor Curtin joins him, and the two doctors work continuously to treat patients, teach a growing number of ophthalmology residents and fellows, and construct an eye hospital. On January 21, 1962, Bascom Palmer Eye Institute opens its doors with Dr. Norton as chairman. Affectionately known as the Chief, Dr. Norton humbly holds this prestigious position for the next 30 years. He and Dr. Curtin are joined within 3 years by Lawton Smith, the only neuro-ophthalmologist south of Baltimore, retina specialist Donald Gass, and John Flynn, a pediatric ophthalmologist. The fast-paced 1970s brings many advances in research and treatment. Dr. Gass identifies 15 previously unrecognized retinal disorders. He's later named one of the 10 most influential ophthalmologists of the 20th century. Two doctors, Douglas Anderson and Ralph Kirsch, discover the difference between healthy optic nerves and those in patients with glaucoma. Their findings lead to a gold medal from the American Academy of Ophthalmology. Bascom Palmer retinal specialist Robert Mackamer performs the world's first pars plana vitrectomy using instruments invented by Bascom Palmer biomedical engineer Jean-Marie Perel. Today, this surgery is one of the most common procedures performed in ophthalmology. With these breakthroughs, Bascom Palmer begins its long tradition of medical education and training as ophthalmologists around the world flock to Miami to learn from our doctors. As patient demand grows, it becomes evident that a bigger and more advanced hospital is needed. In 1976, Bascom Palmer Eye Institute opens its flagship center, the Ann Bates Leach Eye Hospital, hailed at the time as the greatest eye hospital in the country. The 1980s is an exciting time as the nation's best and brightest ophthalmologists are recruited. Harry Flynn begins clinical studies to determine how best to treat patients with diabetic retinopathy. Intensive studies on surgical procedures to correct nearsightedness are overseen by William Culbertson. His findings lead to development of the popular procedure now known as LASIK. Paul Pomberg redefines glaucoma treatment throughout the world by identifying the target pressure in the eye. And Dr. David C. is recruited to establish the service of oculoplastic and reconstructive surgery. Bascom Palmer's vision research and medical education programs also expand. In 1980, the Ritter Auditorium opens as a state-of-the-art conference and training center. Then, Bascom Palmer's researchers and scientists get a new home when William L. McKnight, founding 3M chairman, and his wife Evelyn donate funds for a technologically advanced research center after asserting that research is the key for tomorrow. Yet another stellar highlight in the 1980s is the establishment of Bascom Palmer's crown jewel, the Mary and Edward Norton Library of Ophthalmology. It stands today as one of the world's most comprehensive collections of ophthalmic wisdom. In the 1990s, Bascom Palmer's doctors continue their pursuit of groundbreaking treatments. To enhance patient access, Bascom Palmer expands into Palm Beach County under the leadership of John Clarkson, who becomes chair upon Dr. Norton's retirement. Having achieved this dream of an eye hospital that adheres to principles of excellence and is second to none, Dr. Norton is pleased to see Dr. Clarkson take the reins. During this pivotal decade, Richard Forrester pioneers research on infectious eye diseases. Extensive research on inflammations of the eye begins by Janet Davis. Richard Parrish, then chairman of the Institute, studies anti-cancer drugs to prevent scarring after glaucoma surgery. Accident victims, cancer patients, and children with orbital deformities receive life-changing treatments thanks to David C.'s extraordinary talents in reconstructive surgery. Bascom Palmer celebrated the decade by being ranked the #1 eye hospital in the country by U.S. News & World Report in 1994, a feat that would be repeated time and time again. In the new millennium, Carmen Puliafito, Bascom Palmer's 4th chairman, brings his inventive work in retinal imaging, as optical coherence tomography allows doctors to see changes in the eye long before symptoms are apparent to the patient. Philip Rosenfeld saves the vision of millions of people around the world when he pioneers the treatment for the wet form of age-related macular degeneration by injecting the eye directly with a colon cancer drug. Following a worldwide outbreak of fungal infections by contact lens users, Eduardo Alfonso delivers a global health warning, resulting in the recall of a popular contact lens solution and a significant reduction in the number of new infections. Victor Perez leads a remarkable multidisciplinary team of physicians who uses a patient's eye tooth as a prosthesis to hold an artificial lens. This revolutionary procedure, the first of its kind in the U.S., allows a woman to see again after being blind for nearly 10 years. Bascom Palmer's expansion continues north and west into Broward and Collier counties when offices open in Naples and Plantation. Later, an impressive medical and surgery center built on a beautiful and spacious campus is unveiled in Palm Beach Gardens. It instantly becomes a model for eye care centers around the world. Although having grown rapidly through the years, Bascom Palmer has always considered community service an integral part of its mission. In this regard, the Institute's Vision Van, a 40-foot mobile eye clinic, provides invaluable eye screenings to the underserved throughout South Florida. Following Hurricane Katrina, Bascom Palmer's medical team of physicians and technicians traveled with the van to Louisiana and Mississippi to meet the eye care needs of storm victims and emergency responders. And after Japan's devastating earthquake and tsunami in 2011, the Vision Van was flown overseas to provide support to the hard-hit Sendai province. By training Japanese ophthalmologists to use the van to its full capacity, Bascom Palmer, once again, made a lasting difference. Now back in South Florida, this mobile clinic continues to help communities all across the region. Be it local or international, Bascom Palmer physicians continue to set the standard regarding treating patients and training physicians. For more than 50 years, many of the most important innovations that have transformed ophthalmology have come from one place, Bascom Palmer Eye Institute. Under the leadership of Chairman Eduardo Alfonso, Bascom Palmer's team of dedicated professionals continues to advance the frontiers of ophthalmic medicine, provide outstanding academic training, and deliver exceptional care to its patients. With more than 50 years of vision, Bascom Palmer truly is second to none.